following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Tonight's topic, glaucoma. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. More than 3 million people have glaucoma. Half of them don't know it. Glaucoma is a group of eye diseases that gradually steal your sight without warning. If you're not diagnosed and treated early, glaucoma can lead to total blindness. Who should be screened for glaucoma? What are the symptoms? And how is glaucoma treated? We'll get answers to those questions and more tonight from our two guests. Dr. Judy Charlton, Chair of Ophthalmology at WVU School of Medicine, whose special interests include glaucoma and cataracts, and Dr. Kenneth Mitchell, a WVU ophthalmologist who also specializes in glaucoma treatment. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Judy, we'll start with you. What exactly is glaucoma?
Well, what most people think glaucoma is elevated eye pressure, but that's not it. What glaucoma is a progressive optic nerve damage condition, and with that, you lose sight from the outside in. And it's often associated with elevated eye pressure, but not always. And so the old definition of glaucoma is elevated eye pressure no longer holds true. It really comes down to assessing the optic nerve and its function.
Okay. And there's different types, Ken, of glaucoma.
Yes, John. The most common type is a painless type of glaucoma in the United States called open-angle glaucoma. And because it's painless, we sometimes call it the sneak thief of sight because the patient has no symptom from it until late in the disease when they start to lose their eyesight. Then there are some rarer types of glaucoma that can cause sudden onset of pain. And then there are other types that are associated with underlying eye diseases like diabetic eye disease, or if you're very, very farsighted, that can cause a type of glaucoma.
Okay. Well, Judy, if there may be no symptoms, how do people know that they have glaucoma?
Well, the best thing to do is to get routine screening eye exams, and that would be a full examination. It's just not good enough to go to the health fair and get your eye pressure checked. But it's particularly important that starting at the age of 40, you should get a yearly full comprehensive eye exam at least once a year. And sometimes, depending on how it looks, the eye care provider may say, well, you're good for 2 years. But you must just be checked for it because you can't wait for the problems to occur.
Okay. So once you hit 40, you need those eye exams for sure. Are there any other risk factors?
Oh, yes. African Americans are at greater risk for both developing glaucoma and having it as a more aggressive disease. Hispanics also. And all of us, as we get older, are at greater risk for glaucoma.
Okay. So what are some of the other symptoms then that are accompanying glaucoma?
Well, the most typical type of glaucoma in the United States, the open-angle type, you actually don't notice anything until you've lost 80% of your optic nerve fibers, and that loss is permanent. We can't regain the eyesight then. And things you would notice would be difficulty functioning in dim light and not seeing as well off to the side. It becomes very dangerous for those people to drive, and it has creeped up on them and they don't really realize how much peripheral vision they've lost, and they may try to keep driving, but things will show up from the side and it makes it very risky. Now, the other type of glaucoma Dr. Mitchell talked about was the narrow angle glaucoma type. That is more unusual, and that gives a glaucoma attack, where you have a sudden onset of extreme pain, and it's enough pain you know you need to go to an emergency room. It's not subtle, and there's often nausea and vomiting associated with it.
Okay, we have our first caller tonight. George from Harrison County is on the line. George, welcome to Doctors on Call. Do you have a question?
Yeah, I was told I had cataract on my left eye, and shit hadn't removed. Can I still get glasses and be able to see without having this cataract removed? When I close my right eye, everything's fuzzy with the left one.
So you have a cataract in your left eye, and your doctor recommends that you have it removed, and you want to know if you can just correct that vision with glasses?
Right.
Okay.
It's fuzzy whenever I'm...
Well, I have bad news for you, George. The glasses just won't cut it. What glasses do is focus light through your pupil back to your retina, and your problem is the cataract just won't let the light into your eye. So by changing your glasses, you can change the focal point all you want, but the light still just won't get into the back of your eye. So changing glasses does not compensate for cataracts. Okay. Did you want to add anything to that? Any other thoughts?
No.
Okay. Well, we'll get back to glaucoma and some of the symptoms. We talked about them, that it could be asymptomatic, but the other symptoms. What can prevent, is there anything we can do, Ken, to prevent glaucoma?
No, the only thing we can try to do is to prevent the damage from glaucoma, to prevent the visual loss and the economic loss and the emotional loss from glaucoma. And the way we do that, as Judy mentioned, is to discover it early and treat it appropriately. We don't have a good screening test where everybody at the beginning of their life could have like a genetic test to see whether they're going to develop it later in life. But hopefully we'll come down to that someday.
And there are some forms of congenital glaucoma?
There are children who are born with glaucoma. When they're born, their eyes appear very large. And initially, sometimes the family thinks that's a good thing because we often associate large eyes as a sign of beauty. And they think their child has a special gift, but it turns out it's an eye disease. So actually very large eyes are of concern. And as the pressure goes higher, the cornea gets a milky look to it. So the eyes no longer have a definitive color, it's a milky look. And if we don't catch it right away and do surgery right away, it's permanent blindness.
Boy, we don't want to scare parents out there, but we're talking about the colored part of the eye being large, not the eye itself bulging?
Correct. Well, actually, the whole eye does get large, but particularly what you would notice first in a newborn is that with the eyelids open, you would see more of the color part than normal. But the good news is pediatric doctors working in the newborn nursery are trained to look for this, and pediatricians are trained to watch for this. So when babies are going in for their 2-month check, 4-month check, 6-month check, the pediatricians are often aware to watch this and refer them to an ophthalmologist should it occur.
Okay, very good. Well, we have our next caller. We have Max from Gilmore County. Good evening, Max.
Good evening.
Hi, do you have a question?
Yeah, I have a question. Every once in a while, in the corner of my eyes, maybe not over the pupil of it, but there's just like water rolling underneath in my eye.
Interesting. What do you make of that?
This is coming from one of the corners of your eye, like the outer corner or the inner corner?
The outer corner of it, it don't go clear over to my pupil. Now, it may last an hour, or it may last 15 minutes. It just goes away, and it don't happen anymore, maybe for 2 or 3 weeks.
Okay, and you're saying that you feel like water is leaking from that outer corner?
No, it's just like a cloud of water rolling. Just rolls in my eye.
I see. Are there any flashing lights with this symptom?
No, it's just like a flood in my eye. You know, it just rolls like water rolling in my eye.
And it lasts for up to 15 minutes?
Yeah, and then it just goes away.
Does it ever get followed by a headache?
No,
When you were a younger fella, were you a headachy younger fella?
No.
Well, that's an interesting symptom, and I think that that's the kind of symptom that really requires an examination. Something that comes on all of a sudden, lasts for a certain amount of time, seems to involve part of your vision, and then disappears completely, might be a type of visual migraine, even if you never had headaches as a younger fella. But in order to determine that, I really think it needs to be looked at.
You know, Ken, I have allergies, and sometimes when I rub a lot, the outside of my eye underneath my conjunctiva will get swollen like that. Could he be talking about that?
You know, I thought when he first started, but then he said it was like a flood in his eye. And then I started to think that maybe it wasn't just an external condition.
Interesting. Well, Max, we definitely recommend that you see an ophthalmologist about that. We have our next caller. It's Dan from Harrison County. Good evening, Dan.
Good evening.
What's your question?
I've had glaucoma for 30 years now, and I'm 66, and I have 3 children, and they have regular checkups with their ophthalmologist. And is there anything we can do besides getting IOPs done that would predict if they're going to have glaucoma?
Well, if you could pick only one test to do, the new research shows that what you should select is a test called pachymetry, which measures the thickness of your cornea. Thin corneas are much more prone to develop glaucoma. Thick corneas have less of a risk. So if you could only pick one test, it would be central corneal thickness.
Okay, for all the kids.
For all the kids.
And how often would that need to be done?
Once.
Just once? Mm-hmm. Okay, very good. But they would still need follow-up because of his family history of glaucoma?
Right. When we assess glaucoma, you can never do it on just one test. It can never be just one eye pressure or just one look at your optic nerve. You just absolutely need to get, with this strong a family history, yearly follow-up is very important.
Okay. Now, Ken, you were telling me something beforehand about family history and siblings versus parents.
Yes, actually, it seems that family history is an important factor in glaucoma, but when you look at family history, there have been studies that looked at twins, and they seem to have an increased risk of glaucoma if your sibling had glaucoma. It may be that having a sibling with glaucoma may put you at greater risk than having a parent with glaucoma. It's not to say that a child of a parent with glaucoma shouldn't be tested. Everybody that has a family member with glaucoma should be tested.
Very interesting. Our next caller is Autumn from Wood County. Good evening, Autumn.
Good evening.
Welcome to Doctors on Call. Can we have your question?
Yes, sir. I'm calling in regard to when children are born, and it seems to me there is a continuation as the drops being put in their eyes, as far as in the past the worry of contacting syphilis from the mother. My question is, does that need to continue to happen, those drops in the eyes, because it's my understanding a child at birth can see, and could that be a predatory, or could that cause some problems as the child grows older?
So, Autumn, you're talking about the routine drops that all babies get at birth.
That is correct.
Okay.
Well, obviously the incidence of syphilis has decreased, and mothers now get much better prenatal screening. And I guess one of the questions is, should we stop with these preventive eye drops? And the answer is, well, probably not, because even though very few children need the eye drops, syphilis in the eye of a newborn is quite severe and potentially blinding. Now, the good news is the drops that prevent the syphilis in the eye have dramatically improved, and they're no longer the irritating, nasty drops that they used to be. So they're really quite benign, and I think they should be continued.
Mm-hmm. Well, I think that it's, I think you might have meant gonorrhea, because gonorrhea is a condition of the newborn, or actually a few days after birth. Syphilis is transmitted transplacentally and would require systemic antibiotics to prevent. But I'm sure that that there's some prophylaxis or preventive installation of some chemical to prevent these neonatal infections.
Yeah, so it's almost like immunizations, right? I mean, we've eradicated a lot of things, but we still give you the immunizations, and if you stop, you can also often see an uprise of that problem again. Well, while we're talking about drops, let's get into treatment for glaucoma. What's the most common treatment for glaucoma?
Well, often patients want to start with eye drops. For many patients, the first treatment could be a choice of either eye drops or a rather simple office laser procedure. Now, I say simple because the only thing simple is a surgery that someone else is having done to their eye. But for practical purposes, it's not a trip to the operating room. There's no incision. There's not a long post-operative recovery. So we typically start with eye drops first, or there's some patients that don't want to be bothered using eye drops, or they have arthritis and can't get the caps off of them, or they're truck drivers and they don't want to take medications on the road with them. And for them, about 80% of them can receive benefit from an office laser treatment. And then if the office laser treatments and medications don't work, we do have surgical options, and those are quite good. Ken, do you want to touch on the surgical options?
Certainly. Surgical options include procedures that allow the inner eye fluid, not the tears, but the inner eye fluid to get out of the eye back into the bloodstream. And these are bypass operations. There are several different types. They involve either putting a tube in the eye to get fluid to drain back into the bloodstream, or to make a little partial thickness hole into the eye to allow fluid to get back into the bloodstream. There is a new procedure, a couple of new procedures, but one that's very appealing to my way of thinking is called a trabectome procedure, where through a very small incision, much smaller than modern cataract surgery, a thin strip of the blocked tissue can be removed. And the advantage of this procedure is that although it does require a trip to the operating room, there's no physical activity restrictions afterwards, and there has been no progressive complication following this procedure. It doesn't work for every patient, but I think it has a great amount of appeal as a new treatment for glaucoma.
Very good, interesting. Well, we have our next caller, Virgil from Randolph County, is on the line. Good evening, Virgil.
Good evening, doctors.
What's your question?
We have a new granddaughter out of state, and she's now 3 months old. She was born with a drooping eyelid on the one eye, partially open. And would this be ptosis or some other cause? And at what age could it be corrected?
Well, this is what we call congenital ptosis. The spelling of it's a little unusual, P-T-O-S-I-S. If anyone wants to Google that, that's what you would look for. And basically, the muscles that elevate the eyelid on one side did not develop properly. Typically, what we do is watch the child to make sure they're developing equal vision in both eyes. If the drooping is significant, the child will prefer the more wide open eye and start to ignore the image from the droopy eyelid eye, and that eye will become lazy. And if that happens, then we get much more aggressive in wanting to raise the eyelid. If, however, the child is using both eyes equally and the droopy eyelid is not causing a visual deficit, then we like to wait until the child is a bit older, often over a year, because we get a better cosmetic result if we can wait longer.
Okay, and will some of these get better on their own, or? Usually
not.
Okay, so it's going to need some treatment at some point. Let's get back to the other treatment. The new procedure that you were talking about, is that an outpatient procedure as well?
Yes.
Okay, so in the office.
No.
Oh, in the operating room, but outpatient procedure? Yes. Very good. So can we talk about, when we're talking about eye drops, what exactly is the medicine that's used in eye drops, and what is its mechanism of action?
Well, we have many different types of eye drops we can use. Right now, the most commonly prescribed class of drugs for glaucoma is a class of drugs called prostaglandins, and they're used once a day, typically at bedtime. And they work quite well. They lower pressure well, and only having to remember to use them once a day is quite attractive to the patients. Some disadvantages are they are on the more expensive side of some of our glaucoma treatments. A month's treatment would be about $80 a month, as approved to some of our older drugs that are available in generic formulation that would be like $20 a month. Patients with hazel eyes, blue eyes with brown flecks, about 15 to 20% of them will have their eyes become more brown in appearance. And some patients grow very long and luxurious eyelashes with them. And actually, one of the drug companies came out with a new preparation just to rub on your eyelashes for eyelash growth, but
for cosmetic reasons.
For cosmetic reasons.
That's interesting.
It also can darken your eyelid skin. So who knows, you may get long, luxurious eyelashes, but you could also get dark bags under your eyes. So.
Interesting. Okay, our next caller is Richard from Jefferson County. Good evening, Richard. Welcome to Doctors on Call.
Hi. I just was flipping through the channels, and I saw you were on and the subject you were discussing. I have never had any type of vision loss. No one in my family wears glasses until I went to get my driver's license renewed last year. I couldn't pass the test. I went to a local chain. I'm sure I'm not allowed to say the name, but they have a vision center, and they gave me eyeglasses. And maybe 3 months later, then I became, I don't know, nearsighted. I couldn't read close up anymore wearing my glasses. I had to actually put the paper back and forth, take my glasses off. And I went back, and they gave me another, a different prescription. And I'm talking in less than 12 months' time, it's getting worse. Now I'm going to have to make another appointment. I can't imagine what this could be or have anything. No one in my family has eye trouble.
And how old are you, Richard?
Just started. I'm 48.
So Richard's 48, and he has progressive acuity problems.
Thank you. Yeah, focus.
Right. Richard? Richard?
Yes, sir.
Yes, quick question. Before you got your first pair of glasses from the chain merchant that had an optical service, were you able to read up close with no glasses on?
Yeah, I've never had any vision problems whatsoever.
Okay. You might have been developing a little bit of nearsightedness in middle age, and that enabled you to be able to read up close without glasses. But it would have fouled you up at the Motor Vehicle Bureau because the eye exam, even though it may be on a table through a little testing instrument, is really a distance vision test. So if you're nearsighted, you're going to not pass the distance vision test. Then when you got your glasses, it gave you good distance vision, but in your 40s, if you're wearing your distance glasses, you can't read up close anymore. So, and then you got a pair of glasses that was possibly a bifocal or a progressive lens, but now you're finding that it needs to be made a little stronger. So these things may just purely be part and parcel of middle age, and I don't have a cure for that.
Okay.
Well, right now I need to get another prescription or something, and this will be my third pair in 11 months.
Okay.
Are you diabetic by chance?
No, the doctor, that was the first thing that they suggested when I went the second time, that I go get full blood work.
This is a little bit of a loaded question. Should Richard will seeing an optometrist versus an ophthalmologist, will he have the same tests that he needs for this particular type of problem?
Well,
In 20 seconds.
it sounds like it's a refractive problem, and that would be something that an optometrist would be able to take care of and help you with. Sometimes when the glasses prescription is changing this quickly, it can be an early onset of a cataract, and you may want to get assessed by a cataract specialist to see if that's the case.
Very good. Well, we've been talking about glaucoma with Dr. Judy Charlton and Dr. Ken Mitchell. Thank you both for being with us tonight. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good.
Join us again next time for another edition of Doctors on Call.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.